I'm here with Dr Elizabeth Menzel and we've just finished an amazing 4-day program. First of all, welcome to Sydney, Australia. I think the most poorly taught subject in dental school around the world is diagnosis and treatment of TMD. What's your point of difference in incorporating the management of a patient who has joint pathology and orthodontic care?
So I will have two approaches. One is to prevent TMD from developing at a later stage in life, and the other one obviously is treating TMD patients, whether they be young or older. We are living in a society where we have a lot more stress playing a role in what we do. And yes, of course, teeth as such will not be the causative factor, but they will certainly add on to all the stress that we have, and that will definitely aggravate the situation in TMD.
What I've seen in your programs is very much an emphasis on balancing muscle.
Absolutely.
There really is a war between bone, teeth and muscle in orthodontics, but muscle always wins. Can you just elaborate a little bit on that point?
Teeth have an importance, but they're not as important as is breathing, as is swallowing, and then only we will be confronted with mastication. So the teeth will have that third position, and the muscles will play a much larger role in, first of all, ensuring that the breathing works, ensuring that the swallowing works, and then only mastication can come into the game. So correcting teeth according to mastication will not work if I don't allow for a good breathing pattern, for a good swallowing pattern, and that's why the muscle will run, because it's trying to do the other two first.
Perfect, makes perfect sense. Some of your most amazing cases were your open bites. Can you tell the general population about the face former, because I thought that's really a unique key to what you've developed.
The face former is an amazing little appliance, as is the aqualizer, for instance. Both of these appliances control or try and work with muscular function and try and reorient muscular function into the correct direction. With the face former specifically, we're trying to concentrate on nasal breathing, getting away from the oral breathing pattern, as well as getting the tongue thrust corrected, getting the tongue in a natural and physiological position. And while we're doing all of this, we can do orthodontics and see that we have a much better mandibular correction, and we see that we have mandibles that are in posterior rotation going into anterior rotation, which means faces that were long before, they actually close down, and we have much healthier and prettier looking patients after our treatment without just doing extrusion on teeth.